that Tourette syndrome is an endocannabinoid deficiency syndrome, quote, unquote, which is remarkable. So why does it sometimes go awry? When we're in utero, it begins about 19 weeks in utero, we begin to develop this system, these receptors, these ligands, anandamide, 2-AG, and then the enzyme. And as we hit, as we're born, there's still an increase in our endocannabinoid system. When adolescence begins, this skyrockets. It skyrockets in development as we begin our neuromaturation process. So children, babies, children, and then a skyrocketing. But as we age, like everything else, we begin to lose our endocannabinoid system. And many of the symptoms of aging are the same symptoms you get with a lack of an endocannabinoid system. You get restlessness, you have agitation, you get discomfort, you get insomnia, you get basically all of these things that happen to you are appetite changes, are a result of your endocannabinoid system. And one of the demographics that benefits the most from cannabinoid medicine are those who are losing their endocannabinoid system. So as that begins to diminish and go, you begin to see the benefits in people as they get older, as they replace it. So that's an amazing thing.
Okay. Yeah, because one of the fascinating things about the endocannabinoid system is that it really is everywhere. And I think that makes it hard for them to pinpoint, because you mentioned how concentrated the neurotransmitters are in the brain, but they're also all through our body and different organs, and seem to have multiple uses with multiple cannabinoids and terpenes, and there's so much interactive play in both the endocannabinoid system and the plant that's quite fascinating.
You're right, Ted. It's a real Gordian knot as to how to unravel the endocannabinoid system, because the CB1 and 2 receptors are replete in the body. And it's always important to underscore, one place they are not is in the brainstem. This is the nerve center for our respiratory systems, our cardiovascular systems. And I always emphasize that the endocannabinoid system does not exist in the brainstem, which is why you can say with confidence, and it's hard to say anything with confidence, but you can say with confidence, nobody ever dies of cannabis, because the brainstem controls your breathing and your cardiovascular system, and there's no receptors there. You know, as you know, they've tried to kill monkeys with cannabis, and the only way they can do that is by crushing them under the weight of the plants off as they unload it from the truck, so to speak, right? It's impossible to find that LD.
Or just give them smoke and no oxygen.
Yeah. There you go. Sounds like you've thought this out, Ted.
Well,
but that sounds cruel. But anyway, it's but you're right. This is in fact how vital this ECS is to our body. It is in our skin, it is in our gut, it is in our bones, it is in our liver, it is in many organs and tissues, and it is in parts of the brain that are vital for many of the symptoms that cannabis addresses. Things like the amygdala for anxiety levels, is in the hippocampus for memory, the hypothalamus for appetite, the motor cortex for coordination, or the cerebellum for coordination, the motor cortex for movement, even the areas responsible for pain. These are areas that the CB1 and CB2 receptors, CB2 receptors are in the brain, by the way. People think it's typically not, but it turns out it is in some parts of the brain called the microglia. But the CB1 receptors, of course, are the ones that people recognize as being in the brain, neuromodulatory. The CB2 receptors are more immunomodulatory, but in many conditions that actually works together for helping some chronic neurological systems.
Okay. We have a question here.
2 minutes.
Oh, okay.
And peace to you, and peace to all of us.
And I got this to watch, so I might be good at time.
So again, it's okay.
It's okay. Well, aside from, I guess, being diagnosed, is there any way a person can tell that they're having trouble with their endocannabinoid system? Or
You know, more and more studies are coming out showing that there are changes in the levels of anandamide and 2-AG in certain conditions, like migraines and dysmenorrhea. So that is very intriguing to find out, that when you do a lumbar tap, spinal tap on a patient with migraines, there's a dramatic change on the levels of anandamide in the cerebral spinal fluid in patients with some types of migraines. We see more and more conditions where the receptors, of course, change based on conditions, so that if a child has a seizure conditions, they have all sorts of CB1 receptors out there because they're trying to grab every single anandamide ligand they
You mean they're
can.
making extra receptors?
They're upregulating the receptors, they're making more to respond to the condition. So that's the amazing thing about the body, is that we adjust to our disease processes by trying to make more receptors. Why? Because we're trying to get more cannabinoids, which may not be there, our endocannabinoids. So this is where, when we use plant cannabinoids, we can step in and intervene like we do with so many other conditions, whether it's thyroid, diabetes, hormones, the list goes on and on. But this is exactly what happens, that the body is very sensitive to our endocannabinoid system is very sensitive to our own personal health.
Okay.
All the time. Yeah.
Well, thank you very much, Dave.
Yeah, no
It's
problem.
a pleasure and a joy.